I am so pleased and honored to introduce you to our next eminent speaker, Dr. Neera Bhikha. She is Bachelor of Technology in Neurophysiology from Durban University of Technology, South Africa, Masters in Health Sciences, Olva Walters University from USA, Certification in Intraoperative Nerve Monitoring, MBA in Healthcare Management and Leadership, Italy, PhD in Health Sciences, Carden University. She has presented in various international and local conferences with educational workshops in the advancement of neurophysiology. She is the owner and director of Santon Sleep and EEG Laboratory and member of the South African Sleep Society. We are eager to know about your experience about sleep disturbances in COVID era. Now over to you, ma'am. Thank you.
Breaking news. A heavily mutated COVID variant emerges in South Africa, evading the body's defenses. The World Health Organization has named it Omicron, a beta variant, also known as the lineage B.1.1529, has 32 mutations of spike protein that can affect the virus's ability to infect cells, but harder for immune cells to attack the pathogen. This ominous news can truly disrupt our sleep patterns and create fear and anxiety. Good day, colleagues. Namaste, Sanobona, Dumelang from Johannesburg, South Africa. I am Neera, a neurophysiologist based at Santon Mediclinic in Johannesburg. I have a sleep diagnostic clinic specializing in sleep disorders and epileptogenic syndromes. So today I'm going to discuss with you many of our sleep disorders that we see in our clinic, and the most common disorders are insomnia, sleep apnea, narcolepsy, restless leg syndrome, quite a few parasomnias, REM behavior sleep disorder, and the non-24-hour sleep-wake disorder, and patients with hypersomnia, which is excessive sleepiness. Sleep is magical. It is an escape from our consciousness. It is that thread that links good health to our bodies. And sleep deprivation can lead to daytime fatigue, cognitive decline, and mood disorders. So normal sleep, the physiology of normal sleep, our 4 stages of sleep. So you have your REM and your non-REM sleep. And these sleep cycles are measured via an EEG. When patients come into my clinic, they are booked for a polysomnogram, which is an overnight sleep test where the various physiological parameters are measured during the night while the patient is set up with various sensory probes that record EEG, which is electroencephalogram, EOG, which is the electrooculogram, and electromyogram, which is the muscle activity. And with that, we have the respiration, which is also monitored. And on there, we're able to stage the different stages of sleep. And REM sleep is identified by hypnopolygraphic patterns of relatively low amplitude and mixed frequency on the EEG. So when patients come to me, we get a full history of the patient, and then all this is documented, and then the polysomnogram is then read and analyzed with the different epochs and the different stages of sleep. And thereafter, a report is generated, and the report is then sent off to the referring doctor. And our team at Santon Mediclinic is a multidiscipline team consisting of psychiatrists, physicians, cardiologists. We also have gastroenterologists that are there, and we also have an endocrinologist. So it's really multifaceted where our patients are seen at every level. So during the pandemic, I have documented the increases in the rates of insomnia and mental health disorder. Prior to the pandemic, 30% of my patients had a sleep maintenance insomnia or difficulty staying awake. And during the pandemic, it almost doubled. So that became 60% with the sleep onset or difficulty falling asleep, which increased. So we have been seeing many patients with this type of insomnia, and this coronasomnia caused by disrupted sleep patterns, burnout syndromes, and this long COVID syndrome, which is what we are currently seeing in the laboratory. And us as healthcare workers are very much prone to this type of sleep disorder, where even amongst my colleagues, I have found that they are complaining to me about having higher levels of stress. So 80% of my colleagues have reported insomnia, more females than males, I must add. And yes, and that has also been due to the stress levels increasing and cortisol levels increasing, that operates inversely to melatonin production and therefore disrupted sleep. And then the sleep-wake cycles are disrupted, so there's a delayed phase insomnia that is present. And by that means going to bed later and waking up later, and thus obstructing the circadian rhythms that are present. So when we go back and we say, what is coronasomnia and how is it affecting us as healthcare workers? So it has been identified during the pandemic, even with patients with COVID insomnia and patients that have been tested COVID positive. In my laboratory, we find that the COVID patients present with disrupted sleep, being in an ICU environment, and that is due to the coughing. They have trouble breathing. A lot of them are on oxygen, on ventilation. So that has created sleep disorders for COVID patients too. And even once they are discharged from the hospital, going back into their home environment, they still present with disrupted sleep patterns. So many of the symptoms, patients that had pre-existing insomnia, and with the COVID pandemic, it has been intensified because there's been a loss of the daily routine. So due to the increased media consumption, living during a global pandemic, everybody has been affected. So the major symptom is falling asleep, difficulty maintaining sleep continuity, and that's has been for a period longer than 30 days due to the increased stress levels. And there has been, most definitely in the patients that I've been seeing, a high incidence of anxiety and depression, intrusive thoughts, and symptoms of sleep deprivation. And that has led to impaired daytime functioning. So throughout the COVID pandemic, it has documented increased levels of insomnia and mental health disorders. And in individuals with onset insomnia during the pandemic has definitely increased it has definitely doubled in my laboratory during this pandemic. So who's at risk? It's all of us. It's all of us. And in the clinic, what we've done is we've looked at all the healthcare workers, the frontline workers, all the essential workers, and they have all presented with some type of sleep disruptions. And then we ask the patients, the general public, uh, with the sleep disruptions, there comes a lot of underlying medical and psychological problems. So understanding the increased stressful environment uh, helps you. What is the solution to the corona insomnia? And that is by reducing the everyday stresses in our lives. So it's a matter of creating routines, the loss of routines, the loss of these social markers definitely reinforce our circadian rhythms, where our routines had to become flexible during the pandemic. So in the sleep clinic at Santon Sleep and EEG, we are now asking patients to connect with us via telemedicine, so there can be online therapy. So even for the polysomnogram, we've asked patients not to come into the ward just to minimize the risk of infection, but rather to have home-based studies. So that's where sleep medicine has been heading. We've had to climatize our laboratory for this type of testing. We had to protect ourselves by going out to patients rather than exposing patients to a hospital environment. So, yes, and then the other sleep disorder that I've seen quite a lot of in my sleep clinic, bearing in mind it is South Africa, and in South Africa, 31% of men present with morbid obesity. 68% of females are obese, and of the 68%, we get almost 48%, which also present with morbid obesity. So obesity in South Africa is growing at an alarming rate. So my next topic or sleep disorder that I've been seeing a lot is sleep apnea. It's obstructive sleep apnea. So snoring is no joke. So we humans have been joking about snoring and trying to measure our spouse's snore. But loud snoring is a serious sign of obstructive sleep apnea, and it's a major life-threatening disease. Sleep apnea in South Africa has affected predominantly our female population. And so what is sleep apnea? In the total layman's terms, apnea is a word coined from the Greek roots meaning without breath. So in some patients, the relaxation of the soft tissues at the back of the throat, the tongue, the soft palate during sleep tend to collapse and occlude the upper airways. And the airways is then blocked and the patient is unable to catch a breath during these apneas. So it's a total cessation of breathing for a period of 10 seconds or longer. And that's what the polysomnogram measures. And with the cessation in breathing, we get your saturation levels dropping, and we get other crucial parts of the body that is oxygen deprived. And in South Africa, we have seen this because of the increased the rise of obesity in our general population. And we see men presenting with medium to moderate obstructive sleep apnea, and we get mixed apnea, we get central apneas, which start off in the respiratory center of the brain. And all this is measured during an overnight polysomnogram. And then the patient is treated. The gold standard for treating obstructive sleep apnea is a CPAP machine, which is a continuous positive airway machine that the patient needs to use daily during sleep, during the night, during the sleep. So all it does, it takes normal air pressure and blows it out at a positive air pressure during the night. This method is a little bit, it becomes a little bit complicated for the patients if the right interface is not managed. At the moment, there's plenty of different mouthpieces available where the patient can try out. But sleeping with the CPAP machine has proven to improve daytime functioning as well as the quality of nocturnal sleep. So in my lab, most of the patients, they have been presenting with, especially the male population, with moderate to severe obstructive sleep apnea. And these patients have had 3 times more likelihood of a stroke. And in my patients with hypertension, and we are talking about hypertension, drug-resistant hypertension, we have found that in this type of patient, a lot of them have primary sleep apnea, and often by treating the apnea, the blood pressure also tends to normalize over a period of time. In my patients with coronary heart disease, we have 25% of them that did have obstructive sleep apnea. It may have been a mixed sleep apnea patterns that were picked up. And then 58% of the patients had mood disturbances. 80% of my patients presented with loud snoring. So that is a loud environmental type of noise. And 60% of my sleep population was actually an obese population, which increased the BMI. We had increased BMI of 30 kgs per millisecond. And 80% of the men presented with sexual dysfunction also were tested positive for OSA. So these are alarming statistics. And these are factors that make us fully aware that we need to get tested. We need to be assessed by a sleep practitioner. So how do you know if you have sleep apnea? Do you have loud snoring while sleeping? Has your spouse reported episodes of pauses in your breathing? Do you suffer from recurrent awakenings during the night? Do you suffer from excessive daytime sleepiness? Do you have high blood pressure? Are you depressed? Are you irritable? Do you have diabetes? Do you have impaired memory or problems concentrating? Have you experienced weight gain? And all these are the red flags for patients with obstructive sleep apnea. And you're not only a hazard to yourself, but you're also a hazard to your partner, because your partner also suffers from daytime fatigue and disrupted sleep patterns. So it is essential to have yourself tested and create an awareness amongst our population, because it can be treated. So thank you for your attention. I appreciate it. Hopefully, I wasn't too boring to make you fall asleep. For those who dare to dream must first fall asleep. And I think I just want to leave you with those thoughts. Thank you for listening.
Thank you so much, Dr. Neera. It was quite interesting. So you should not worry about if we were feeling sleepy or what. You actually threw light on what is the current status of, especially in COVID-19 period, what was the status of patients regarding sleep, and it really helped us. We are so lucky to have IISS and Santon Sleep Lab to give us information or expertise from modern medicine's perspective. I have a question for you that it is quite interesting. You name of the institution is also interesting, Sleep Lab, and work you have done in COVID-19 era is really interesting and really helpful. I want to know that if there is any reference or there may be any project you have in mind to work with traditional medicine systems of Africa, or even if you have any experience working with Ayurveda and yoga practitioners in this your practice, your experience, you please share with us. Are you there, Dr. Neera?
Hello.
Hello.
Hello. Yes. Hi. Can you hear me?
Yeah. Yeah.
Okay. Good afternoon. Thank you so much for having me. I really appreciate it. As I mentioned, we have a full-on medical practice. So I haven't been working with any Ayurvedic doctors because in my facility, we don't have any Ayurvedic practitioners or yoga for that matter. But I think it'll be a very valuable asset to have patients being referred to this facility, because I think modern medicine is so tired of all the sedatives that are prescribed on a daily basis for our insomniacs. So I think it'll be a lovely introduction to our patients. Thank you.
Thank you so much for such honest and open-minded answer, because most of the times many people at their household, they use some herbs, like if as you know, Indian people tend to have some kind of household remedies. They call it like grandma's remedies, and they tend to do that first and then go to the doctor. So even the same case happens with African patients as well. As they first go to their traditional healers, they seek guidance from them, and then they come to us. Is there any interesting case you came across with regarding use of is combination use of some traditional medicine, and now you are treating them, or there is some kind of collaboration you have done, means not intentfully, but it happened like that, because it happens most of the time. So just out of curiosity, I'm asking you if there is an experience you have in South Africa with this kind of practice.
Yeah, so not really with traditional medicine, but with lots of foods and herbs and spices. Some of my patients would say they would have a banana and milk prior to bedtime, or they would put lavender under their pillow, or they would have a concoction of warm milk and honey. And I mean, those foods are all rich in sleep inducing agents. So yes, I mean, all of those are very welcome. So all I've heard of was really food and a bit of spices that have been used, but not actually traditional roots or anything like that. And I've always encouraged that sort of natural inclusion in their diet, and always encouraging them to have a carbo high meal towards the end of the day, because that also encourages sleep. Yes, so I think yes, that natural methods definitely do play a role.
Thank you so much. You have shown positive response for any collaboration work in future is done, because we are lucky to have IISS on board that is quite interested and very open for these kind of researches. And if you can be with us in collaboration with this kind of project or any project which you have in mind, please let us know. We will be waiting for your suggestions, and we are also waiting for some queries from all the delegates or other speakers in reference to your presentation, and we will let you know. We'll convey that to you definitely. Thank you so much, Dr. Neera. It was
Oh,
great
thank you so
honor.
much for having me. It's been an absolute honor to be part of your conference, and I am also hoping to open up a whole new dimension on sleep medicine in South Africa. Thank you once again. Namaste.
Thanks a lot. Namaste. Thanks a lot. Thanks a lot.